The Tobago economy has been on a continuous downward spiral. And this is not a condition that is said from a personal standpoint. This condition is borne out by the data from the Central Statistical Office. Our economic situation has worsened significantly under this administration. And despite receiving a historic $2.58 billion in 2023, in fact, the most any administration has ever received, there is still no clear pathway that is shared with the people of Tobago on how they intend to fix it, as promised and as was central to their campaign. It is truly disappointing to hear the Chief Secretary continually deflect any time any question is asked with regard to an explanation of the spending of the budget of the THA. It is truly disheartening. The matter suggesting as his response that government, the central government, owes them money and owes Tobago money. We are not disputing that. But the constant deflection from his own accountability is what is concerning. Unfortunately, we see that there is no transparency. Contractors still remain unpaid in some circumstances. Service providers are months behind in payment. And essential services like school buses and transportation for disabled persons seem to be neglected. The social safety net has failed, and many are hungry and unable to afford health care and even medication. We must realize that a failing economy inevitably leads to increase in crime. We are witnessing an alarming rise in crime, and not just in murders. We are also seeing it in increased burglaries to businesses across the island, making it truly unsafe for businesses to operate. In turn, that impacts on the economic performance of the economy. And it's no rocket science. We must understand when people are unable to feed themselves and feed their family, their desperation takes in, and that leads to crime. This administration must take responsibility for creating an environment that seems to allow crime to thrive. They must take responsibility. After all, the buck stops with them. The upcoming budget is yet another area of concern. Where's the meaningful consultation with the various sectors and communities to understand what their true needs and priorities are? Where's that consultation? How are they coming up with their budget requests that they are going to be presenting to the people of Tobago and then to the central government? Instead, we are seeing this administration going down a path that seems to be dictatorial, and them issuing to Tobagonians what they want, further alienating the very people they are supposed to be serving. This is for this very reason. This is why the IDA has consistently been advocating for community empowerment through constitutional reform. We believe in an elected Senate whose job it is to ensure that people in communities are engaged and their voices are heard. This will ensure equity in the distribution of resources across communities, ensuring that no community is left behind. The time for this kind of change, we say, is right now. We cannot allow this administration to continue with the approach it has adopted. We must demand accountability. We must demand transparency, and we must demand participatory democracy, meaningful participatory democracy at that. The IDA stands ready, therefore, to lead this change and to empower communities and to bring about a Tobago that works for the benefit of all people. The final matter that I want to address is the financial relationship between the Tobago House of Assembly and the central government, and to focus specifically on the THA's financial accountability. The IDF firmly believes that transparency and accountability are key pillars of good governance. The people of Tobago deserve to know how their money is being spent, and they deserve leaders who will fight for their financial rights. And it is simply unacceptable for any administration to operate without providing clear, detailed accounts of its expenditure. We cannot ignore the fact that Tobago is owed money, as I said before, from the central government. The Minister of Finance has acknowledged this debt, and it is crucial that these funds be released promptly to meet the needs of the island. However, it is equally important that we scrutinize the current allocation, including that $2.58 billion that was received by the THA, to see how it has been utilized, if it truly has been utilized in the best interest of Tobago. It is to this end that we call on Chief Secretary Farley Augustine to provide a detailed account of the $2.58 billion allocated to the THA, and we hope that in this upcoming budget, we will see just that. The people of Tobago have a right to know where every dollar is going and how it is contributing to the development and betterment of the island. Deflecting from his responsibility and pointing fingers will not solve the problem that Tobago currently faces. We need clear, transparent reporting, for this is what will do that. The Innovative Democratic Alliance also stands ready to champion the financial rights of Tobagonians and to ensure that every dollar is used effectively for the island's development. We therefore demand that the central government uphold its financial commitment to Tobago, and without delay, it gives to Tobago the resources it requires for its development. To ensure transparency and prevent any potential malpractices, the idea calls for an immediate review by the Auditor General of the THA's spending. We must avoid at all costs any situation that is akin to the alleged cooking of the books that we observed in Trinidad. An early and thorough audit will provide necessary oversight to restore confidence in our financial governance. Members of the media, fellow Tobagonians, this is not a time for egos to play. This is truly a time for the both leadership, both on the Trinidad end and the Tobago end, to put aside petty differences and in the interest of both islands, Trinidad and Tobago, to ensure that both islands, and especially Tobago, gets the sort of resources necessary for allowing it to be able to drive an economy that can contribute meaningfully, not just to Tobago development, but to national development as well. I therefore open the floor for any questions anyone may have on what was presented to you.
In relation to the issue of crime that you mentioned earlier, are there any specific initiatives the IDA sees it could put forward for addressing the situation?
Well, definitely, that engagement with civil society is very critical. Apart from some of the community efforts that will be done through policing, we are saying that the continued rebuilding of the social fabric is necessary. You need to look at youth programs that would engage our young people and give them alternatives, meaningful alternatives. We need to take another look at the education system. because sometimes people believe they don't have choices. Academia cannot be the only way to bring development to Tobago. There's skills and vocational trade. And to have that work itself out at the community level, we must champion the need for community empowerment. In fact, going around to the communities, especially in response to the constitutional reform call, communities have been saying they are ready to handle their business. They require the resources. And therefore, what the IDA has been championing is the need to see community and community development as the third pillar for development nationally. And therefore, we need to ensure that communities are empowered at a constitutional level, so that they are given, just as there is local governments and the municipalities in Trinidad, we need to craft something that fits the Tobago space, empowering our communities that would allow them to take charge and not be fully dependent on the THA. In fact, the THA has done itself an injustice by constantly seeing community development as an execution of programs of the division, instead of the development of the community to handle their stories that they know will be as the facilitators in terms of ensuring the appropriate resources and capacity building is in place.
And the Prime Minister's response was, you can have all of these programs, but many times the young men, some of young men to the other stereotype, just choose that life. We have everything, but I want to live this kind of life. How do you believe, from the IDA's perspective, we can really address that?
But the thing is, we can't, that's why we have to look at the whole person. The whole person, there's that part of the skills training, but there's also the building of the human person, the social part of the individual. A lot of the times, a lot of us as individuals have been challenged by certain kind of social stigma or certain kind of socialization process that has happened to us. We end up being the children of divorced parents, of abusive parents, and that in itself has created some degree of kind of maladjustment. So that is why civil societies like our churches, our NGOs, our youth groups now have to work hand in hand with these government programs or these community programs so that they're addressing the whole individual. We're building back the social fabric, some would even say the moral fabric of the community, and enhancing their capacity in terms of their skills development. We are doing everything from all aspects to make a productive citizen. And focusing on one side of the human would not do that. If there are no further questions, I would like to call to the podium to address you the political leader of the Innovative Democratic Alliance, Dr. Denise Sawyer-Angus. Dr. Angus, the podium is yours.
So a pleasant good afternoon to everyone, members of the media. And thank you so much for that comprehensive presentation, our PRO, Kate Trotman. And my role today is to address some serious issues, some sad issues around treating with our children and the welfare of our health sector. And the IDA is deeply troubled by the recent reports of child abuse at the Couvers Children's Home and Crisis Nursery. From news reports, this abuse issue was ongoing for at least 2 years without support for addressing the issue. Our hearts go out to the victims and their families. One child abuse is one too many, and we must take immediate and decisive action to address the issue. It is therefore with great disappointment that we have observed the response from the Minister in the Office of the Prime Minister, Mrs. Ayanna Webster Roy. As a minister with responsibility for gender and child affairs, it is unacceptable, and I repeat, unacceptable, for her to distance herself from the suspension of the manager who blew the whistle on these abuses. The minister claims she is not responsible for the oversight of the home, stating that her role is limited to ensuring financial resources. This response is inadequate and unacceptable. The role of a minister is not just to provide financial resources, but to ensure that those resources are used effectively to protect and serve our citizens, especially our children. The minister's refusal to take responsibility and her lack of action in initiating an investigation raises serious questions about her commitment to transparency and accountability. The IDA calls upon the minister to request an immediate and thorough investigation by her permanent secretary into the suspension of the whistleblower by the board. Anything short of this would be perceived as a cover-up and a failure to protect our children. You know, the minister boasts of having the Children's Authority Act being passed in Parliament and perhaps being the only one in the region that has ever been passed. And now that it is being tested, the whistleblower is being thrown under the bus by the board and apparently being condoned by the ministry. It is not enough to highlight positive achievements when convenient, while shirking responsibility when issues arise. The minister must demonstrate consistent leadership and accountability. As a female political leader and mother, I am deeply pained by the minister's response. Our children deserve better, and it is our duty to ensure their safety and well-being. The IDA is committed to safeguarding the welfare of all children in Trinidad and in Tobago. We will advocate for stricter oversight and accountability in state-owned care facilities to ensure such incidents do not occur in the future. I will now move on to Tobago-specific matters. If we had to discuss the health care and the failure of the healthcare system, it would probably take us a couple months right now. It's that bad. And so today, I want to focus on what occurred on the 15th and 16th of May, where as an island we experienced the devastating loss of a mother, Nadia Shangi, 27-year-old clerical assistant at Speyside Health Center, and her newborn, Sinaya, which occurred at the Scarborough General Hospital. We were told by the Division of Health, Wellness and Social Protection and the Tobago Regional Health Authority that they conducted preliminary internal investigations into these tragic deaths. And while the findings have absolved the staff at the hospital of any negligence, stating that their doctors, nurses, midwives, and other healthcare professionals did everything possible to save Nadia's life, this is not enough. I am here today to question why the administration has not proceeded with an external, independent investigation by experts capable of conducting a comprehensive systemic analysis. An internal investigation, no matter how thorough, lacks the objectivity and impartiality required in situations of this magnitude. It is unacceptable to rely solely on an internal review when what we need is a transparent and unbiased assessment to ensure the highest standards of accountability and trust in our healthcare system. And I speak from experience. When I recall in my role as chairman of the TRHA in about 2006, the board also had to grapple with baby deaths around that time. And we decided to call an independent investigation. And we had experts from, medical legal persons, the quality from the Ministry of Health, and other experts in the field that actually reviewed not just the incidents from a blame game deflection, but looking at the whole picture. And that report was able to show us where, maybe equipment was not in place. The maintenance of equipment was not up to scratch. The use of the equipment was not appropriate. The personnel that were there enough personnel in terms of the human resources around? Was there support for the personnel? Because in a hospital system, it's not just about the nurses and the doctors. You have a whole slew of ancillary care factors that you have to look into. Were the personnel trained? Were they trained adequately? Are they implementing and doing all their duties appropriately? What about accessibility to the hospital? What about ambulance services? What about the adequacy of the healthcare facilities on the island? Are there enough hospitals? And this is what we are calling for. We're not just calling to say, well, the doctors and the nurses did it right. We want to know if the Roxborough Healthcare was a 24-hour facility and up to scratch as it was supposed to be built. We were told that this is what we were going to get, a hospital. We weren't told that it was a healthcare clinic. We were told that Roxborough has a hospital. If that hospital was operational, would we have those persons here with us today? Those are some of the issues that we have to look at, and not just an internal investigation that says they did everything that they could. It is time we begin to look at the whole picture. And therefore, we are calling on the Secretary to take immediate steps to initiate an external independent investigation into the deaths of Nadia and baby Zanaya. We must ensure that our healthcare system is held to the highest standards of accountability and transparency. The family of Nadia and Zanaya deserve nothing less. Furthermore, the idea is calling on the Secretary to go further and tell the people of Tobago what is being put in place to address a broader issue of the declining birth rate on the island. Yes, we know that there's a declining birth rate in the country. Trinidad, being at 1.2 million, can afford that decline. Tobago cannot afford that decline. And therefore, we are asking her what is being put in place, studies or otherwise, for us to make sure that that declining birth rate is arrested and we begin turning around that trend. This is a significant concern that demands immediate and comprehensive action additionally. And we must work towards understanding the underlying factors contributing to this decline and work collaboratively to reverse this trend. Our community's health and future depend on it. And the people of Tobago deserve nothing less from you and the administration. So, in conclusion, I really urge the public to join with us in demanding accountability and transparencies from our leaders, not just in Tobago, but also in Trinidad. Thank you. Questions? As someone who led the commissioning of the Scarborough General Hospital, when I was the advisor to the senior advisor to the then Secretary of Health and Social Services, I would have bought that in the first year of them coming in. But now you're 2.5 years into administration, I no longer buy that excuse. That hospital could have been up and running already. You have adequate persons out there who could have led a commissioning exercise and had it up and operational today. And so that excuse no longer holds with us, nor should the people of Tobago continue to accept that excuse. Like I said, in the first year, sure, you're 2.5 years in, that hospital should have been ready, commissioned and open already for the people of Tobago to use.
The Standing Finance Committee of the House of Representatives has decided to give the THA $50 million in supplementary allocation in its engineering review for the oil spill of the restoration. What are your thoughts on that? They had initially asked for $153 million, I believe. What are your thoughts on that?
Short-sighted. What do I mean by that? Number one, when you look at what they said they're paying for, they're just paying for the immediate issues that are being dealt with. The cleanup, paying the persons who would have done the cleanup. I see catering services in there. just really shallow thinking and not thinking of the true impact of the oil spill on Tobago, its economy, the livelihood of its people, and even the health of its people. When we look at the shark attack that occurred, and we spoke to our experts, they actually suggested that the shark attack may have been related to the oil spill. Because with the oil spill, you have moved away the food from the immediate area where the sharks would have it. Secondly, the chemicals from the oil spill, because it was so great, could essentially have sent the shark mad. Okay? So that is one area. We're looking at the impact on the fisher folk. I understand is what, $1,000 that this assembly paid to the fisher folk for what they're getting? That is nowhere near compensation for the impact that they're having right now with not being able to fish in those waters or having to take transportation and go different areas to do the fishing. The impact on that would be years for us to study. We right now should be studying our person's health status right now as a baseline, and over time looking to see if there are an increase in cancers over the next 5 years from this oil spill that would have occurred. Okay? So you're talking about increase in the amount of our healthcare bill to treat with this oil spill that would have occurred 5 years before. But you can only know that if you are studying the trends. And I certainly hope that the Secretary of Health and Wellness is taking that into consideration and has her team deployed, which she has to pay. So that's another budget. She has to pay that to determine and to assess the health care of the people over the next 5 to 10 years to see what rate of cancers we are having and what type of cancers that we are having coming up. We have to look at the downstream of the fishermen, the agro-processing sector. Are they getting enough to support their businesses in terms of coming out of the sea? We have to look at our the marine life and the biodiversity in terms of our crab life, our all the others that are coming on. I was told that the crab, the crabs that would normally be in those areas have actually moved and migrated inland. Is that going to change the type of crabs that we will be seeing? The impact is so great. And some of them would have been exposed because some of them they're seeing coming out with the oil slick on them. The impact is way more than they are wanting to look at. They say they're always treating Tobago well, but is it treating Tobago well when you're being so short-sighted about our future? This oil spill will have a significant impact on the Tobago economy even further, given what we live on from the sea. We also have the impact of tourists. Tourists were looking on at everything that was going on. That has also been and is also going to be an impact, because those who are looking at sand and sea tourism will definitely be looking elsewhere. And I dare say that this administration did not take the opportunity at the time when we had all of the highlights going on to show the rest of the world that we have different beaches along different parts of the island that may not have been affected. So I dare say that 50 million is short-sighted. When you look at what they said they're paying for, it's a highly short-sighted budget. But again, perhaps we can understand that if the Assembly has not been able to say what they have spent the 2.58 billion on, there may be hesitancy to put more in their hands at this time. Any more questions? Okay. Let me take this opportunity to thank you all for being here. and to thank the Tobago public and Trinidad and Tobago for continuing to support the Innovative Democratic Alliance and our role in championing the people's voices. Thank you.